Today we've got dental calculus, which is fundamentally mineralized bacterial plaque. It will not be seen in edentulous patients because you need to have teeth or a prosthesis for calculus to form on it. So if you don't have teeth, you won't have calculus. It is of two types. It can either be supragingival or it can be subgingival. If it's supragingival, as the name suggests, it is coronal to the gingival margin. If it's coronal to the gingival margin, that means that it's present on your enamel surface. And if it's present on your enamel surface, it will be visible. And in consistency, it is clay-like. It is easily detached, but not with a water spray. With any abrasive surface, though, it can be detached easily. It is most commonly present in areas where there's an opening of a salivary gland duct, such as the lingual surface of your mandibular anteriors, or on the buccal surface of your maxillary molars. It gets its minerals through your saliva because it is in direct contact with your saliva. In color, it is yellowish white. Then we have your subgingival bacterial plaque. It's not bacterial, calculus. Another thing about calculus I forgot to mention earlier is that it does not always have bacteria present in it, because plaque, on the other hand, always has bacteria, but calculus is mineralized bacterial plaque, so it doesn't necessarily have to have bacteria present in it. So the other type we had was subgingival bacterial calculus. Subgingival, as the name suggests again, it is below the gingiva, under the gingiva, so it is below the crest of the gingiva. If it's below the crest of the gingiva, it will not be visible to you directly. So in order to detect it, we use a 621 probe. We can also use an explorer, but yeah, so through tactile perception, you can do it either with an explorer or with a dental probe. That's how you identify it. In consistency, it is hard and dense, unlike supragingival, which is clay-like. It is firmly attached to your cementum, and any root surface can be involved. It's not necessarily the buccal surface of maxillary molars, nor is it necessarily the lingual surface of mandibular anteriors. Any root surface with a periodontal pocket can have some gingival calculus, but the prerequisite is that there should be a pocket present. Another thing about it is that it does not cause pockets, but instead, after a pocket is present, bacterial plaque that's present inside the pocket will later be calcified and turn into calculus, but calculus itself does not cause the pocket. It gets its minerals from gingival crevicular fluid, and in color it is dark brown or green-black. Then we have the attachment to the tooth. How does calculus attach itself to the tooth? It's by three methods. It could either be through a pellicle, through mechanical locking, or through penetration. By means of a pellicle, what happens is that it can either be attached to the cementum or the enamel, because a pellicle itself is a sticky adherent structure. Mechanical locking, we all know it's through frictional surfaces that interlock with each other. And it could also be through close adaptation, which I didn't mention here, but it could be through close adaptation of the undersurface of the calculus to the depressions and molds of the cemental surface. The fourth method is by penetration of bacterial calculus into the cementum. The composition is super important, especially for OSPEs. Now the calculus itself can be proportioned into two major proportions, which is predominantly calcium phosphate and also has calcium carbonate. There may also be presence of calcium phosphate, but only in traces. Now we can divide its composition either into inorganic or organic. Inorganic makes up about 80% of the entire composition, so it's super important to remember, out of which 39% is calcium, 19% is phosphorus, and then we also have a little bit of carbon dioxide present there. Potassium is also present as an inorganic component. Then we have the organic components, which include protein, polysaccharides, desquamated epithelial cells, lipids, leukocytes, and various microorganisms. It may also have carbohydrates such as glucose, galactose, and mannose. Theories of mineralization. How does mineralization actually take place? Another thing about calculus that I also didn't mention earlier was that the outer surface of calculus is always covered by plaque, bacterial plaque. So bacteria are always present on the outer surface of calculus, but not actually inside calculus itself. So in the theories of mineralization, calculus begins to mineralize inside to outside. So meaning from the inside of the calculus and the part that is in close contact with your enamel surface or your cemental surface, the mineralization begins there and it works itself outwards into the outer environment. The theories of mineralization are four. So are actually basically two. It can either be through a local rise in the degree of saturation of calcium phosphatidines, or it could be through seeding agents. Now, if it's from the first method, the first method is further classified into three different types. It could either be due to a rise in the pH of saliva, or colloidal proteins that bind to the calcium phosphatidines, or it could be due to phosphatase, which is liberated from the dental plaque. Now, if you have seeding agents are intracellular matrix of plaque, carbohydrate protein complexes, or plaque bacteria. These are seeding agents, and it's known as the epitactic concept and also known as the heterogeneous nucleation concept. Next, we have material alba. Material alba is, if you compare it, you should compare it with dental plaque, because if compared to dental plaque, it is less adherent than dental plaque, so it can easily be displaced even with a water spray. It's a soft, sticky deposit that's grayish-white in color, and it's fundamentally the accumulation of microorganisms, which include, it's not just microorganisms that are present in it, but there's food debris, epithelial cells, leukocytes, saliva, and lipids. Well, that's it for today. I hope you guys understood this.